I tore my rotator cuff, the supraspinatus to be exact. I had bone spurs. I tore my bicep. My labrum was degenerating. And on top of that, I actually had adhesion in my shoulder. In 2016, I was diagnosed with Hashimoto's, which is, autoimmune of your thyroid. And I went to a functional medicine doctor, and they put me on all kinds of supplements and stuff like that. And it was like, take this supplement, take that supplement. And I just wasn't happy with with what was happening with my body. So I'm like, you know what, forget this. I'm gonna go work out and, figure this all out myself. I'm gonna work through diet, I'm gonna work through exercise, and I'm gonna figure this all out. I'm gonna fix my thyroid, not be on medicine, and I'm just gonna do that. So I started working out, and I'm like, okay, I want a challenge, so let me go to CrossFit. So joined CrossFit and started working out, and I beat the hell out of my body. I did 5 a.m. workouts, and I loved the challenge. I will never, ever, ever, say anything terrible about it, but I loved the challenge. It just started having problems, overworking my shoulder, heavy lifts, not doing things correctly. And then, I started having pains in my shoulder, but, I went to a chiropractor and we would tape it. And the following February, I fell on ice, and that was it. I was done after that. I was in so much pain. I knew that I did some damage to it. I didn't want to get surgery. I had gone to 2 doctors, non-surgical doctors, and I didn't like their answers. So I was sitting one night on Instagram looking, and I came across an article by Dr. Chris, and I'm like, oh my gosh, I need to meet this person. Everything he was talking about was spot on. He's in Denville, and I'm like, that's 20 minutes away. It was like it was a Wednesday or Thursday night, and I called the next day.
Kristen's my girl. She came to us 3 years ago or so with pretty severe shoulder pain. I believe we knew that she had a supraspinatus rotator cuff tear at the time, maybe even a labrum tear, I don't remember. And during the exam, it was really, really bad.
I went to a non-surgical doctor, and he recommended a PRP injection. And I didn't like what he had to say. He was like, we can try this or we can try that. And I'm like, no, I don't like that. I went to a pain management doctor, and he's like, well, we can do stem cell, but I want to, get an MRI and see what's going on. And I'm like, no, I don't like that either. Then I found Dr. Chris, and I told, I had the phone consult, and I told them what happened, and they said, okay, come on in. So I went in and saw Dr. Chris, and now, again, this was April of 2019. He said, okay, we're gonna schedule you for the exam so you can come in. And he starts doing the exam, and after, it was like 10 or 15 minutes, we did all the testing and everything, and he sits me down and he goes, Kristen, he's like, I'm saying this in the most honest way possible. He goes, you need to see a shoulder surgeon. He's like, I believe there's something more than adhesion going on in your shoulder. He's like, I would love to help you, but I can't. So he said, go find a shoulder surgeon and let me know what happens.
She has struggled with depression all of her life, similar to myself. And also similar to myself, she found CrossFit and fell in love with it. And she found that it really made her excited and happy. And I find often when people use exercise or CrossFit as their form of addiction, what they do is they push through pain. So she started getting pain with all the overhead motions that she was doing, and pushing through that pain. Eventually she just tore the heck out of her shoulder. And during the exam, we found a little bit of adhesion, but we sent her straight to the surgeon. We said, this is not a case for us. This is a surgical case. So unfortunately, you are very, very likely gonna need surgery.
So I got an MRI of my shoulder, and it turns out that I needed shoulder surgery. I tore my rotator cuff, the supraspinatus to be exact. I had bone spurs. I tore my bicep. My labrum was degenerating. And on top of that, I actually had adhesion in my shoulder. My surgeon told me after my surgery, I was only scheduled for 45 minutes. It took an hour and 15 minutes. He goes, Kristen, you had so much adhesion in there. He's like, I had to scoop it all out. The next day I sent Chris a message, and I'm like, I told him everything. And he's like, you had a very extensive surgery. And he said, he's like, please let me know how you progress with physical therapy and everything. And if you need anything, let me know. And that July of 2019, I started physical therapy. Physical therapy was 3 times a week, all the way up until January of 2020. I ended up 6 weeks in the sling. And what happened was I already had frozen shoulder, so my shoulder got stuck again. And so I ended up getting a cortisone injection in my right shoulder because it was stuck. I did 92 or 93 physical therapy sessions, and I still wasn't 100% recovered. I still had pain.
So she ended up going to get surgery. And then I think a year or 2 after that, her arm was in a sling, and she ended up developing more adhesion than she previously had with the recovery, and she still had a lot of shoulder pain. And then she came back in, and the rotator cuff tear was fixed. It was good. So that made our job really easy and straightforward. So we're like, okay, now during the exam, I can feel a lot of adhesion that's pulling really tight. We started care, and she started getting much, much better.
So I met Kristen after she had surgery on her right shoulder. She had a labrum tear and some other stuff that needed to be repaired in her shoulder. She came into the office because now she was getting pins and needles down her entire left arm, and her left shoulder was now starting to act up. This started to concern her, considering she just had shoulder surgery. We've done a lot of treatment with Kristen. We've really worked into cleaning up her nerve roots here, which are the nerves as they exit the neck and they innervate or control her hand.
I was afraid I was going to live like this for the rest of my life. I already suffer from depression. I was diagnosed around 13 with depression. And the fear that I'm gonna live like this, is it ever gonna go away, brought that back. I mean, I've managed it for years without medication, but it's like, am I gonna live like this for the rest of my life? Am I ever gonna be able to swim? Am I ever gonna be able to take a shower and wash my hair and not hurt? Am I gonna be able to do something so minimal and not feel pain? Am I gonna continue to wake up in the middle of the night and, have to adjust myself? Putting on a t-shirt hurts. It's living in chronic pain changes you because you don't realize what you take for granted every single day. And then when it hurts, you're like, oh crap, is it gonna get better? Is it ever gonna stop?
Did you have any skepticism coming into barefoot?
Absolutely not.
No,
not
really
first,
not?
None at all. Absolutely not at all. The first time when I sat down with Dr. Chris, it was just me and him. He was so kind and he was so genuine, and he told me, Kristen, I will help you if I can, but if I can't, I'm not going to take your money. I never for a single second had any skepticism about it at all. Just from what I read and just him as a person, I wholeheartedly believed and connected with him almost immediately that this person is genuine, this person is true. He's not out to take your money. They genuinely care. So I was never skeptical for a single second.
She's able to do everything that she normally was doing, and more importantly, she doesn't have any of that numbness that goes into the hand anymore.
I love Dr. Joe. He's awesome. He makes me laugh. My second visit, he actually made me cry because it was so painful, but he's like, I'm sorry. Joe is just such a genuine person. He cares about you, your physical being, your mental well-being. He just cares so deeply. Plenty of times I've sat there and just cried, and he just sat there and listened, and he said, Kristen, if you need something, send me a message. He's like, it's absolutely fine. He cares so much. We have so many times, we laugh the entire appointment half the time because we just talk so much. And when he sticks his pointer finger, his thumb in my neck, and I'm like, Joe, and then I start to giggle, and we have so much fun in there because, I'm not focusing on, the pain. I'm focusing on, okay, it's a couple minutes and you're going to feel better. So I love working with Joe. He's awesome.
When you get pins and needles on your arm and you have pain when you bring your ears to your side, it's a lot of times the nerve can get stuck at the scalene muscles over here.
It's pretty painful. It hurts, but it's a minute or two, and then they tell, he'll say can you handle it? Are you okay? And at first I was seeing him 2 times a week, but my body didn't recover fast enough from the treatment. So he's after about a month of that, I'm like, I just hurt. He's like, okay. He's like, we're gonna scale it back to once a week. And like, that was what I needed. And as I continued to, my symptoms improved and I got more range of motion, he's like, okay, let's try every 2 weeks. And then like once a month. And if I need them, I call and they fit me in, no problem.
Well, levator scab helps support the neck. So if her neck's not moving correctly, this muscle's probably overworked. Go. And lucky for her, there's a bunch of adhesion in here, so I'm just freeing her up to enjoy Key West. Good. Okay, wait there. Stand up, please.
So she came for the shoulder work too, and in the meantime, because of my history with depression, we were able to talk a lot. So I know with Kristen, she liked to tell us about how we've helped make her feel like a better person and made her happier. So we've been able to talk to her about meditation, what the purpose of depression is. A lot of people don't realize when they're depressed that it's a message delivered from our soul or our spirit that's trying to say, hey, the big picture of your entire life, something is way off and you need to change and shift things. And she was very comfortable with superficial level feelings, but wasn't comfortable going deeper into some of the emotions that she was struggling with, some of her childhood wounds and traumas. And we just gave her a little nudge and said, hey, there's something here for you. Your depression's trying to help you, it's trying to open you up. And she was very receptive. And she found that as she started exploring some of her emotions and feelings, this is not typical in a doctor's office. As she started exploring those emotions and feelings, she just started feeling better. So we love Kristen here in this office. Love getting hugs from that woman. Super happy that she trusted us with her care.
I'm not sad anymore. I'm not scared. I'm looking forward to doing things. Swimming is one of my goals, is to go swim again, because that's something I couldn't do for so long. Last summer I tried and I failed epically swimming. I'm like, my shoulder's not well enough to swim yet. But there's so many things, like I'm sleeping better, I'm feeling better. There's so much more that I've gained from going to barefoot than just, chronic, getting out of chronic pain. I stop and I think about things more, and I'm so much more aware of my body and how I'm feeling and how pain, emotional things affect you, my pain level. I could have a terrible day, I could be having the shittiest day, and I'm feeling it. And then I'll realize, okay, Kristen, you're mentally not well today, so your body's gonna react. I cleaned up my diet even more, and that's helped tremendously. And, I'm doing things now that I didn't think I would be able to do, getting dressed in the morning, washing my hair, not being in pain, I can go a full day and not hurt. And I'm not sad about the things that I can't do. There's things that I'm looking forward to doing. I love everybody at Barefoot, I genuinely do. They're so warm, they're so inviting, lots of laughter. If I'm not having a good day, they ask me, they talk to me. They know me personally. I've been going there for, a while. Longer than most patients, I would say. I believe in it so much that I don't think of it as an expense. It's, it's me getting better, mentally, physically, emotionally. They just brought so much to my life that thank you doesn't seem like it's enough. It doesn't. I am so incredibly grateful for what the team at Barefoot has done for me. And I'm not saying that because, this is my testimonial. I'm saying that genuinely because I feel like they brought so much value, not just through my chronic pain, but just me as a person. I feel like I've evolved into a better person of myself. I look forward to going. It's okay, I have my appointment in 2 hours, let's go. I get to hug Joe, I get to see Chris, I get to say hi to Lauren and, talk to people, Crystal is there. I genuinely love everybody there. I feel like I'm just a part of the family.